Welcome to the Afterspin, opinions from thought leaders in our state. I want to ask John Hood and Chris Fitzsimon, this past week a three-judge panel on the Court of Appeals overturned a 2017 ruling that state retirees were entitled to free health insurance after retiring. The panel said they were entitled to access to health insurance, but no guarantee for free insurance was made. What's your reaction to this decision, John Hood?
One could argue the legal case either way. This was done, I think Bev Lake is one of the plaintiffs, and there is an argument that has to do with whether this is a true contract or not that's been established, basically deferred compensation, and can you retroactively change it? And then there's the contrary argument, which ultimately prevailed on the Court of Appeals. Setting aside the legalities for a second, this was an issue of immense fiscal significance because North Carolina already has an unfunded liability, even adjusting for the fact that some years ago they instituted the 80-20 plan for state employee retirees, which did reduce that unfunded liability over time, but it's still gigantic.
And that liability is better than $40 billion.
Yeah, it's a gigantic unfunded liability. And if this decision had not been upheld, and let's see what happens if it gets appealed, I guess it's a unanimous, so it doesn't.
It can't be appealed.
Well, no, it could still get to the Supreme Court. But here's the point:
unlikely to be appealed. All right.
Here's the point: is that the fiscal implications of this are greater than much of what we all talk about on NC-SPIN. That the amount of money is so large, and I'm glad we're talking about it because a lot of times the media, legislators will talk about relatively small fry things. This is gigantic.
Yeah, this is a big thing. Treasurer Falwell applauded this and said it was a great victory so far as being able to help control some of the budget costs of the retiree health.
I'm not so sure that I don't agree with former Justice Lake about the merits of the case, that this was some sort of contract and retirees were entitled to this. But putting that aside, it obviously is a big financial relief to the state. But I'm a little bit amused that all of a sudden now, a lot of Republicans and conservative folks are worried more about the unfunded liability when we have a Democratic governor proposing a budget. They've been writing budgets virtually on their own since 2011, and just last year finally started putting a little bit of money toward what you just described as a $40 billion problem. We cut taxes $3.5 billion a year. We've made a lot of other expenditures in other areas. So now that a Democratic governor is elected and proposes a budget, oh my gosh, we have all these unfunded liabilities. Not when we were cutting corporate taxes, not when we were doing all these other things. So it's interesting that is used now as some sort of response to why we can't invest more in a lot of things that are important in the state.
On the face of it, though, what do you think of the decision?
Well, I'm not a lawyer. I don't have a law degree, but from my reading of it,
that's never stopped us.
No, it doesn't stop me. I tend to think that Justice Lake has a point. That the plaintiffs had a point, a legal point, that the retirees are entitled to this health care coverage free. But again, the issue is the practical effect is it saves the state a lot of money.
And I think that there's a pretty good argument on the other side, which is that the health plan has changed constantly. Since some of these folks went into the system, it's been changed many times in many other ways. It would be unreasonable to argue that the state employee health plan cannot be changed in various ways from year to year.
Or otherwise, you'd have to say, okay, you could have only the benefits that were in force when you came into
Correct.
state
That is the
employment.
argument that I think ultimately prevailed with the Court of Appeals.
Right. On the other hand, that you sign up to one of the things you do as a state employee is you sign up thinking or feeling like you have some inherent promise that you'll have some level of service. By that argument, we could make retirees pay 90% of the cost.
Well, the court said you do have a benefit, but that it was not unconstitutional or not illegal for them to be able to modify the contract and pay some.
If we want to do away with the health care liability, why don't we make retirees pay 90% of their health care costs?
I didn't suggest that, and I'll let you handle the mail. Thank you for watching the Afterspin. We'll have more video all during the week on ncspin.com.